The hiatal hernias are the bulging of the stomach into the diaphragm. The diaphragm is the muscle that splits the chest and abdomen. And the foot pipe enters the gullet through the small opening in the diaphragm. The stomach normally is placed below the diaphragm. If the stomach starts to bulge, then it is called hiatal hernia. It is a very common condition, and when it is small, usually it doesn't cause any symptoms, hence it doesn't need any treatment. Some people, unfortunately, can develop weakness in the opening where the foot pipe travels through the diaphragm. And part of the stomach that bulges through that gradually can bigger and can start to cause symptoms. And these symptoms vary from pain, indigestion, and acid reflux, heartburn. When it is severe and large, it can cause pain very similar to a heart attack, or sometimes even bleeding from the stomach lining. These are quite serious problems, and it can cause complications which can threaten people's life. That's the reason when the hernia reaches a certain size or when it becomes symptomatic, it needs some treatment. There is no obvious causes that are known to us at the moment. However, some hiatal hernias can be present from the birth, and they are called congenital hiatal hernias. Most of the hernias, however, are acquired, meaning people who are obese, carry excess body weights, or who carry out quite a strenuous activity over a prolonged period of time, which increases the pressure inside the abdomen that allows the stomach to bulge into the chest. And these conditions can predispose to a weakening of the hole in the diaphragm and allows the stomach to go up. Normally, when the hernia is small, if it is not causing any symptoms, we can leave it at that stage. It can be treated with some acid medications if indigestion is the only trouble. Most of the time, the doctors find small hiatal hernias when they investigate for some other unrelated symptoms. They don't generally need any treatment. However, if it reaches a certain size or started to cause trouble, then it requires treatment. And the treatment can be either with tablets or in the form of surgery. If it reaches a moderate to severe category, I think my suggestion would be to repair it with the operation of some sort. Generally, it involves keyhole. In certain instances, the robotic surgery. It's mainly for one reason. If the hernia is repaired at the smaller stage, then the surgery tends to be small and the recovery tends to be much quicker, and the chance of hernia coming back will be less. If someone allows the hernia to develop into a much bigger size, and clearly it will become a bigger operation, and also there is a chances of hernia coming back, causing much severe and progressive symptoms later on. When it is small and when it is not symptomatic at all, for example, if it was incidentally identified during a examination, CT scan examination of the abdomen, it doesn't require any treatment. Or if the symptoms are predominantly heartburn, which doesn't bother or doesn't affect their quality of life, then it can be treated with some acid tablets. Moderate to large size hernias or hernias that causes severe symptoms or having symptoms despite being on acid tablets, preferably treated with surgery. The surgery can be done in an open or keyhole or robotic surgery. But the keyhole approach would be the best available choice available at present, because it's a patient can go home in 24 hours time, and it's a incision less surgery, so recovery tend to be quicker, and the technical aspect wise, it is much easier to fix the hernia with the laparoscopic approach rather than the open approach. The robotic surgery is slowly growing, especially in repairing the recurrent hernias or very large hernia. It is called paraesophageal hernias. The straightforward hernias, for example, a moderate sized hernia, can be repaired with the keyhole approach. The patient generally go home within 24 to 48 hours. Robotic surgery plays a very vital role in people who have recurrence of the hernia despite having it repaired in the past. And also when the hernia is massive, or if patients tend to carry excess body weights or have had previous surgery in the top of the abdomen, robotic surgery will be very precise and reduces the chances of recurrence. This is in addition to all the benefits of less pain, incision less nature of the surgery, as you can see in the keyhole operations. We have learned quite a lot in the last couple of years about COVID pandemic. When it started, during the first wave, we were not operating routinely, especially these quality of life improving operations. However, majority of the patients population is vaccinated now, and also we have learned to operate during the COVID viral pandemic. So we have resumed our normal operating 6 months ago, and we are doing all the routine operations at present. So my advice would be, given the nature of the pandemic, all patients who visit the hospital or having an operation or coming to hospital to have a consultation, make sure that you have been vaccinated and completed both the vaccines before you come to the hospital. It is very safe to come to the hospital, and we still follow all the precautions that we were following during the peak of the pandemic in the hospital. So answer to the question is, yes, we are operating, and hospital is learned to do and operate in a very safe manner during the pandemic and now as well. Thank you.